presentation is about using experience-based expertise to plan a pre-hospital research study. So it describes how we undertook a stakeholder event to help us develop research about evaluating paramedics working in care homes. So this was a piece of work funded by the Welsh Ambulance Service NHS Trust, conducted by Swansea University Medical School. My name's Alison Porter, I work at Swansea University. So co-authors on this piece of work include my immediate research colleagues, staff from the ambulance service, and a member of the Enrich Cymru network, which enables research in care homes. And we also had in our team 2 public contributors whose elderly family members have needed care. So care home residents often require emergency medical care. We have a population which is becoming increasingly frail, and residents frequently have comorbidities. So care home staff will call for an ambulance, residents taken to the emergency department, but this can be distressing for them and doesn't always resolve the medical problem effectively. So recently there's been a move towards more innovative approaches, including paramedics taking on non-emergency roles in care homes. So this means them going out providing prospective care to reduce the risk of residents needing to be seen in an emergency. So routine care, very different from that response to an emergency call. So the evaluation of this innovation should take account of the multiple perspectives involved in research about this topic, because it's well recognised that research is more relevant, it's more feasible and accountable if those who commission and deliver and use healthcare services are able to input their professional and personal insights when planning research proposals. So as part of our work to plan research about paramedics in care homes, we held a stakeholder event so that everyone involved could contribute their experience-based expertise to our research development process. So we hired a room in a hotel and invited care home representatives, people from the ambulance service, primary and secondary care clinicians, patients and public members, as well as members of the research team. We all got together. There were some brief presentations which gave background information, and then people involved worked in small groups, as you can see in the picture, to discuss how to undertake research. So we asked workshop members to consider how to implement the intervention of paramedics in care homes and what outcome measures we should record. So they said communication was important between the professionals and residents, and it was clear that it needed to be clear what the paramedic's role was and how this affected other roles. In other words, who does what and when. So proposed outcomes to measure included, at the top of the list, reduction in hospital admissions, and also numbers of out-of-hours calls and attendances at the emergency department. Secondly, dying in the place of choice, which it's more likely to be the care home rather than the hospital. Satisfaction of staff and satisfaction of the patients and relatives. They said it was important to collect baseline data to identify change following the introduction of the role, and also to explore the impact on other services, for example, the time saved for other patient consultations. So overall, what have we learnt? Well, gaining the insights of a wide range of stakeholders prior to research being designed is really important, but it's an underutilised approach in research development. People who deliver and receive community-based care have insight from their personal, from their professional experience, which complements research expertise. We know that research in care home settings is challenging, and there's not really that much of it done at the moment. Our approach enabled people with diverse perspectives to contribute insights which were significant in the development of our research proposal, which is called PERCH. So this was submitted to Health and Care Research Wales back end of last year. So we're hopeful we will receive positive news on funding this year and be able to move forward with it. Thank you.